talk about that scrutiny, and there has been some scrutiny about this, very good scrutiny actually, from Policy Exchange. Now, Lottie Moore is a research fellow at Policy Exchange. She's the author of the report. Lottie, you're very welcome to Talk Breakfast. How are you?
I'm well, thank you.
Lottie, I read a lot about this, and I read the summary, I read a lot of the detail of this. This is kind of terrifying. If there are parents watching this morning or listening this morning, maybe they're actually on the school run, bringing their kids to school, what is actually happening in our schools?
Yeah, so it is really concerning. And actually, our research found that this is not just one school or a small number of schools, but this is systemic. So, you know, 28% of the schools that we sent FOI requests to asking for their policies on sex and gender and how they deal with gender distressed children, 28% of those schools are not reliably, only 28% of those schools are reliably informing parents when a child discloses gender distress.
So gender distress, just to make this clear, this is just very much if it's a boy who thinks they're a girl or a girl who thinks they're a boy, or just some sort of thing that goes away from the sex that they were born with, that they are thinking they're confused about their gender identity, essentially.
Yeah, exactly. So it's a kind of form of body dysmorphia where a child expresses discomfort with their sex body and expresses the wish to change gender. So whether they're a teenage boy that thinks that they might be a girl, and they disclose that feeling to a teacher at school, a standard safeguarding protocol, which would be the case with any other kind of mental health concern, would be, unless there is a good safeguarding reason not to, that those parents should be informed when a safeguarding issue arises. So why are parents
not being informed? Because this should be, you would think, you talk about safeguarding, and this is all to do with all sorts of problems with children, whether they're being radicalised, whether they're being brought into a gang. If teachers and other professionals in schools, or people who aren't teachers as well, have concerns, there are protocols to follow. But is it a lack of guidance, or what is the reason here? Is it woke teachers? What's going on?
Yeah, so I think it's really important to show, you know, I think parents and schools and teachers are united in wanting the best for children. There seems to be, because of the recency of this phenomenon, I mean, this is only really the last 5 years, the number of children that have been presenting with this issue has skyrocketed. And it's been schools that have been sort of left to deal with this influx of identity, and there isn't good guidance. So the Education Secretary in May last year, Nadine Zahawi, said that there would be transgender guidance that would be released. We're still waiting for that guidance, and schools really need it. A few of our requests came back and said, you know, we are waiting on the DfE guidance here.
And you mentioned, sorry to interrupt you, Lottie, you mentioned Nadine Zahawi there. I mean, we've had so many education secretaries. Do you think the government has a grip on this? I
think there needs to be much further thinking on it. And I think that there's been a narrative that this is only one school and that it's not actually as big a problem, and that, you know, a lot of the women's rights groups, you know, are kind of over-egging this. And I hope that this report demonstrates that that isn't the case, that this is systemic.
So what would you suggest that teachers do, what schools do, and what parents do? I mean, obviously they're waiting for that guidance from the Department for Education, but today, if a pupil goes up to a teacher and says, look, do you know what, I'm a boy, but I think I might be a girl, or I feel as if I'm a girl, I mean, what would you suggest in terms of what is happening here, or how the system is at the moment?
Yes, so the report makes a series of 9 recommendations, and there is standard safeguarding principles, protocols that schools know well. You know, these principles are well established, they're enshrined in the law, and they should deal with it like they would with any other safeguarding.
So do they need guidance? I mean, a lot of the teachers and teaching unions and so on are saying we need guidance. I mean, if it's established in law, do they need that guidance?
I think there needs to be more guidance on this issue, particularly because it is tricky, and I understand that. And I understand that there is a narrative that's particularly prevalent at the moment that, you know, we've got to be kind and we've got to be accommodating, and that needs to be balanced with the fact that social transition, which is when a child adopts the attributes associated with the different sex, so hairstyles, pronouns, etc., that is an active intervention. So Dr. Hilary Cass, whose report last year, which was commissioned by the NHS into the Tavistock Clinic, which is the gender identity service for children, made that very, very clear, that social transition is an active medical intervention, that has no place in a school setting. So schools do not have the authority to be making these judgments. They are not medical practitioners, nor should they be expected to be. So we make a series of 9 recommendations.
That's part of it as well, Lottie, isn't it? They shouldn't expect to make these massive decisions, and there should be these safeguarding ideas. And I mean, you have so much process, you have so much paperwork in schools, yet it seems that a lot of this is slipping under the radar.
Yeah, completely. And you know, there should be an automatic process by which parents are informed. You know, parents are by default the most emotionally, socially, financially invested in their child's welfare, unless there is a safeguarding reason for them not to be, you know, involved. You know, the court is very clear that parents are, you know, children are best placed with their parents, and they have the responsibility for those children. And so it seems bizarre that, you know, in order to prescribe paracetamol to a child, you have to get parental permission. You know, a school can't prescribe paracetamol to a child without their parents' permission. So the fact that they are facilitating these serious medical, you know, serious active interventions, which often lead to a pathway of irreversible medical intervention. You know, we're talking hormone blockers, puberty blockers, we're talking cross-sex hormones, you know, potential surgery as adults. It's really, really bizarre that this is happening.
Yeah. OK, Lottie, thank you very much indeed. Lottie Moore is Research Fellow at Policy Exchange, author of that very important report there on serious safeguarding breaches in secondary schools regarding gender. You can go to Policy Exchange's website to look at that. It's covered in all the papers as well. It's on the front page of the Mail and the Times, for example.